Hi everyone, this is my week 12 flashcard on pancreatitis. Pancreatitis may be acute or chronic. The pathophysiology of acute pancreatitis involves an injury to the pancreas, which results in inflammation from autodigestion of the pancreas when digestive enzymes are prematurely activated and not properly secreted. Prematurely activated proenzymes such as trypsin, amylase, and lipase cause inflammation, hemorrhage, and necrosis. Pancreatic necrosis results in peritoneal inflammation and chemical peritonitis, vasodilation, increased capillary permeability, hypovolemia, and shock. Severe pain results from autodigestion of nerves, and bacterial peritonitis occurs from intestinal flora escaping through increased permeability of the peritoneum. This may lead to septicemia, sepsis, acute respiratory distress syndrome, acute renal failure, and death. In chronic pancreatitis, there are three theories of mechanisms. The first one is repeated acute pancreatitis, leading to fibrosis and pancreatic insufficiency, resulting in exacerbations of acute pancreatitis with repeated inflammatory injury. A second theory is impaired bicarbonate secretion, which does not properly respond to pancreatic protein secretion, resulting in lobule and ductal plugs, calcification, and stones. The third theory involves genetic or alcohol-induced activation of pancreatic digestive enzymes, leading to chronic and progressive inflammation. Risk factors for acute pancreatitis most commonly are alcohol abuse, biliary sludge or obstruction, hypertriglyceridemia and hyperlipidemia, autoimmune diseases, post-ERCP, genetics, pancreatic duct injury, and certain medications. Other risk factors include hypercalcemia, infections, toxins, vascular disease, anatomic abnormalities, and idiopathic etiologies. Chronic pancreatitis risk factors, most commonly, it's caused by alcohol abuse and smoking. It can also be caused by ductal obstruction, malignancy, genetics, cystic fibrosis, lupus, and idiopathic etiologies. Major signs and symptoms of acute pancreatitis include severe, tender, epigastric abdominal pain that radiates to the back, increasing when the patient is supine. Guarding. Symptoms may be followed by a large meal or large alcohol intake. Signs of shock may be present with hypotension, pallor, sweating, rapid 30 pulse. A low-grade fever progresses to a high-grade fever, abdominal distension, hypoactive bowel sounds with paralytic ileus formation. Jaundice may be present with biliary obstruction. Gray-Turner sign with pancreatic necrosis is ecchymosis on the bilateral flanks, and Cullen sign, which is also a sign of pancreatic necrosis, which is ecchymosis in the umbilicus region. Altered mental status may also be present. Chronic pancreatitis, it may be painless, but oftentimes has intermittent abdominal pain, nausea, vomiting, steatorrhea, diarrhea, weight loss, and glucose intolerance. Diagnostic testing for both acute and chronic pancreatitis includes CT scan imaging and MRCP. In both cases, you'll find elevated lipase, amylase, and you might find elevated lipids. In acute pancreatitis, neutrophils are present in inflammatory cells. You'll find an elevated BUN and hypocalcemia. In chronic pancreatitis, you'll see monocytes present in inflammatory cells and an elevated CRP. And that's it. Thanks for watching.